Hello, everybody. My name is Farrell, and I'm Head of Communications at the World Hepatitis Alliance. Thank you to everybody who's joined us today. Today, we're going to speak about World Hepatitis Day 2018. And I really hope that you find it useful for your own national activities and find out ways that we can work together both at a local and international level. So I'm joined today by my colleague, Bridie Taylor, who is Communications Manager at the World Hepatitis Alliance, and she also is leading the World Hepatitis Day campaign. And later in the webinar, she'll run through the campaign in detail, illustrate ways that you can get involved, and then answer any questions. And on that point, we'd really encourage you to ask questions throughout the webinar. We do have a section at the end to focus on questions, but we'll try to get as many as possible throughout. So you should all see a question pane in the right-hand corner of your screen. If you type that question in there, we'll be able to see it and hopefully be able to answer it, because that's what we really want to achieve today. Today's webinar is about illustrating you on the campaign, but also highlighting ways that we can work together. So, further ado, we'll kick off. So, I'd like to take a moment to pause and reflect on World Hepatitis Day. As we are all aware, World Hepatitis Day is a global awareness day. And in 2010, it was the first official day recognized by WHO and governments. And today it still remains as only one of 4 disease-specific awareness days. And throughout the years, it has grown on and has grown enormously. And as you can see within the slide in front of you, there has been a massive increase since 2008. And I take particular focus on 2016. And really that was down to the launch of WHO's elimination strategy and of course the launch of No Hep. But what's really interesting to see over the last couple of years, there is a sustained interest in representing the day, both at a community level, but also at a governmental level. And it's something to keep in mind as we move forward, that there is an appetite out there that we can continue focusing our attention on World Hepatitis Day, be it from prevention, awareness raising, advocacy, and so on. And to look into detail a little bit more into last year's results, as you can see here, 162 countries commemorated the day, and that's 104 governments. And at that point, in terms of government participation, in 2012, it was estimated about 50 governments. And in 2017, that's 104 governments. That's over 50% increase. And we need to really leverage this momentum. And then as you can see even further, the number of alliance members and WHO country offices. But also let's look at the impact of the day, because often we hear, what actually is the impact of global awareness days? Is it too saturated? Are there too many awareness days? But what's particularly interesting is the actual activities that happen on the day. And as you can see here, 30,000 people vaccinated, nearly 50,000 people diagnosed, and over 100,000 people attending events. That shows that there is impact, but it also shows how important local activities are and about how we need to work together to really drive that global influence. So that brings me on to my next slide. And really, I want to just take a moment before we go into this year's campaign to focus on what are the objectives of the day. And really one of the kind of main objectives is the importance of creating a global action behind a consistent theme and have a call to action, which we can all use to support our national and international aims. We need to use the day to educate. We still know that there's an incredibly low awareness of viral hepatitis. And we need to highlight how important it is and why it is so important that there needs to be action taken. We need to use World Hepatitis Day 2018 to empower stakeholders, to increase screening and support linkage to care. And I suppose the biggest objective that underpins all of these is the importance of driving action to meet WHO's elimination strategy targets. Now, we all heard, well, most of us have heard at our summit in November, that only a handful of countries are on track to eliminate hepatitis by 2030, and that considerable advocacy is needed to push them forward. So that is why World Hepatitis Day is such an important milestone on our calendar, to unify with our collective voice to push towards meeting these targets. And with that, I'd like to highlight the WHD 2018 theme. I'm sure many of you are familiar with it, as we used it for the last couple of years. But really, going back to that graph where it shows the participation and the increase and what we saw in terms of the last couple of years, we need to really harness that momentum and that understanding of elimination. And we need to use our theme this year to further push that forward and really come back to governments and unite stakeholders to say that 2030 isn't that far off, and we need to use World Hepatitis Day to push forward in achieving that aim. So that is me for now, and I'm going to pass over to Bridie, who will go through the campaign in more detail. But I'd like to use this moment again to remind you that if you have any questions, please feel free to enter them into the panel beside you, and we'll get to them, hopefully all of them, throughout the webinar. Thank you.
Great, thank you very much, Tara. And it's really great to be here today to talk a bit more about the campaign and how you can get involved. So as Tara mentions, we now have commitment from every single country in the world to eliminate hepatitis. But the clock really is ticking to 2030. And while we may have the tools, we have the vaccines, we have the treatment for hepatitis B, we have the cure for hepatitis C, we really are missing something really crucial, a crucial piece of the puzzle. And of the 325 million people living with viral hepatitis, up to 300 million of those, that's 9 in every 10 people, are completely unaware of their infection. They haven't been diagnosed, and they just have no idea they're living with viral hepatitis B or C. So we need to find these undiagnosed people and link them to care. Otherwise, we just won't achieve elimination. So this year, we'll be using the momentum from World Hepatitis Day to launch a 3-year program to find the undiagnosed. We'll be using the Find the Missing Millions campaign to really drive action towards that. But with so many people that we need to find, where do we start? So we are first starting by gathering that evidence and truly trying to understand the issue. This will be crucial to successful advocacy and awareness-raising actions. So we started by thinking, why is it that so many people have been undiagnosed and just don't know that they are living with hepatitis? So in March, we carried out a global survey to understand these barriers. We were really pleased to receive over 500 responses from more than 100 countries. So thanks to many of you who I know took part in that survey. And these findings will form the basis for a meeting that we're holding next month. We are organising a stakeholder consultation meeting and inviting a group of around 30 experts to join us to look at the barriers that together we have identified and see what recommendations we can come up with to overcome these barriers and find the missing millions. This information will form the basis of a white paper that we will be launching on World Hepatitis Day. This white paper, it's basically like a report of our findings, will include all these key recommendations, and in particular, look at what people living with viral hepatitis can do to find the missing millions. Alongside this white paper, we will be producing a video that explains these recommendations, and we really encourage you to use this video in your activities. It can be a great advocacy and an awareness tool, so do look out for that. And our work won't stop on the 28th of July. We need to continue to sustain momentum and keep going to find the missing millions. So this campaign and the programme alongside it will run for 3 years. And throughout those 3 years, we will be working with our members and partners across the globe to do in-country work to help find the undiagnosed and link them to care.
Great, Bridie. Can I intercept there? I have a couple of questions already from the audience. Firstly, there's a couple of questions around the survey. You mentioned that you received over 500 responses. Who were those responses from?
Great question. So we were really fortunate to have responses from such a wide range of different people. So we heard from our members, yourselves, and other people who have sort of lived that experience, people who have sort of are living with viral hepatitis. We heard from other civil society organisations working in the field. And we also, which is really, really important, we believe, also heard from healthcare professionals and policymakers, the decision makers that actually are the ones that need to implement these policies. So a real range, a real variety of responses, which is really important when we're carrying out that research. So it seems that we may have, I'm not sure if this is from a technical issue from my side or from Tara's side, but as far as I can aware, it seems that I can still access. So I think I will continue, and I'm sure continue through the presentation. I'm sure Tara will be back with us shortly. So thank you for those questions, and I think that's a really showing you how we're developing this campaign. It's a really important first step. But next, how can you get involved? What's your role in finding the missing millions? Firstly, we have a role to play in engaging our networks. Then it's all about learning from each other and sharing our experiences. And then finally, of course, using World Hepatitis Day to take action and run things that are really going to make an impact from the 28th of July and beyond. So firstly, how can you engage your networks? Well, we have a whole suite of campaign materials. We have actually over 400 materials, which is more than we've ever really had before. We have the posters that we create every year. This year we have around 15, and we really do see these as sample posters. So they have quite overarching messages. They have global statistics and really aim to just highlight the scale of this issue and sort of highlight that everyone is at risk. But we also have been, this year, for the first time ever, focusing on specific geographies or at-risk groups. And this, for your national and local and regional activities, is really what will be key to successful advocacy and awareness raising. The more tailored you make your message to your local audiences and priorities, the more successful it will be. So we do encourage you to edit these, and I will very shortly show you how you can do that. But to support your message development, we will be, all of the country-specific diagnosis rates will be made available from the Find the Missing Millions webpage on the World Hepatitis Alliance website in June. There's more information on that very shortly. But we also have lots of other materials as well that we believe will support your activities. So we have a whole range of social media graphics, like this fantastic one here, and this little GIF that moves. That can be great to grab people's attention when people are scrolling so quickly through their social media feeds. And we also know that if you're holding an event, so one of the biggest ways to get your message across and get people's attention is by having branded materials. We want to make this as easy for you as possible. So this year, we have a whole range of designs available from the website. All you need to do is download these and take them to your local manufacturer. We have t-shirt designs, hat designs, pen designs, banners. So really, whatever you should need, you should find it on that website. And as I say, one of the most important things for a successful campaign will be around customizing your materials. And as like every year, we have created a customizable poster tool to allow you to do that. It's really, really easy to use. all you need to do is go on the website, click onto the campaign materials page and click create your own poster. Here you'll be able to select the image that you want to use, and then select the language, your appropriate message, and then edit as you see fit. All of the text on these posters are editable, so you can add your own messaging. This is where we really do encourage you to add that local data and your priority messages. But you also have the option to upload your logo. Don't forget to update the preview, and then you can download it as a JPEG or a PDF. Now, the next most important thing will be around learning from one another and sharing experiences. So as I mentioned, the World Hepatitis Alliance will also have a Find the Missing Millions webpage. This will be a hub where we will house all of the activities for the Find the Missing Millions campaign. So we will have lots of case studies on things that are working well for people, things that perhaps aren't working so well, really so we can all understand the best ways to be running screening drives or advocating for testing strategies, all the things that we need to do to find the missing millions. We also want to make sure that the patient stories are at the heart of this. So there'll be an option to share stories through that as well. As I mentioned, the diagnosis rates will also be available on this website. So do have a look and see what the current statistics are for your country. We'll also have photo gallery of all the great photos we receive from you to help find the missing millions. We are really pleased to also announce that this website will hold a online risk assessment. So this allows people to log on and answer a few questions to understand how likely they are to have perhaps been in contact with hepatitis, and really aims to encourage people to go ahead and get that test. It's where the white paper will be housed once it's launched on World Hepatitis Day, and it's also a place where you'll be able to sign up to receive updates about the campaign. And this is where this is an opportunity, I think, for you to really sort of be part of this and share your story. We want to make sure that the human voices are at the heart of this. So if you have a story to share, we do want to hear from you. Perhaps you visited the doctor with symptoms but struggled to convince them to give you a test. Maybe you were misdiagnosed, or your infection was missed entirely. Or perhaps it was really difficult when you did find out about your diagnosis. We want these stories, so please do get in contact with us, and we will be able to promote them on this website. It appears that we do still have some technical issues. So unfortunately, I think we will have lost Tara for now. I have lots and lots of information I'd like to share with you. So I will continue, and then I'm sure we can try and ask the questions once we've done so. So please do bear with us. Thank you, everyone. So of course, this really is the next step is one of the most important parts of World Hepatitis Day activities, and I'm sure why so many of you are here today, and that's about what you can do on the day itself. We know that organising an event remains one of the most impactful ways to mark the day, and this year in particular there are a few things that we think you could do to have a real impact. Of course, wherever possible, we want to be testing people to help find the undiagnosed. So hold a screening event, and I know for many of you resources can be difficult, but there are lots of ways to perhaps try and overcome these. Maybe there are community health organisations or local medical centres that you could approach to help run a testing event. There may be pharmaceutical companies or diagnostics companies working in your country. Why not contact them to see if they're able to provide tests or other support? And this is also something that may be of interest to your local or national governments. They may be looking for someone to partner who has that understanding of the issues. So maybe you want to contact them and see if they would also like to participate and support a testing activity. Now, we also know that sometimes you need to be be a bit more active, and taking to the streets is a really good way to get people's attention. So you could consider organising a march or a rally around your town or city. If you do that, make sure you pick somewhere where the public are going to see you. So plan your route with a place where lots of people go past. And remember to have your message loud and clear. Have your branded materials or have your placards, hand out leaflets. As you're sort of walking through the streets, get your message to as many people as possible. And another really important thing that you could do to mark the day is to hold an educational seminar. One of the things that we know, one of the biggest barriers to diagnosis is the lack of awareness, both amongst public and amongst the healthcare professionals. So you could consider holding an event and inviting perhaps members of the public, maybe it's an event for healthcare professionals, and invite perhaps eminent doctors or local politicians or even civil society organisations that are doing great work, and they can help educate and raise awareness amongst these groups. Now, there's other ways that you can also be taking action on World Hepatitis Day. Maybe you want to raise awareness on social media. We really encourage you to do this. It's free and it's a great way to amplify messages. As I mentioned earlier, we have lots of social media graphics available. Do share those throughout your channels, but also think about other messages that might be of interest to your followers. So share hepatitis statistics, that local data that will be available. Use that in your posts. That can drive real interest. If you're holding an activity, don't forget to promote it on social media. Perhaps you want to create a Facebook event and invite people in your area to encourage attendance. And most importantly, please don't forget to sign our Thunderclap. So from the 14th of June, it's a really important date for lots of things that are coming up nearer the time. From the 14th of June, please sign the Thunderclap. What this means is that on the 28th of July on WHD, a same message will be shared through all of our Facebook and Twitter accounts. And this will mean that we have a much bigger impact. The message will reach many more people if we're all saying the same thing at the same time. And this is one of the key ways that we ensure that World Hepatitis Day also keeps on trending.
Bridie, can you hear me? Yay!
Great to have you back, Tara. I'm sure everyone's very pleased that we've sorted it out.
Thank you. I'm so sorry. I don't know what's wrong with my computer, but it decided to shut me down and it didn't allow me to speak. But anyway, I'm going to use this opportunity because there actually has been loads of questions that have been coming in. So, Bridie, are you, first things first, one of the questions is, when can our audience start using the campaign?
As soon as you like. I mean, all the materials are available online now. So if you want to start using it, please go ahead. We know that the real interest around World Hepatitis Day tends to start around a month beforehand. So if you've got limited resource, we recommend really putting your efforts from June onwards to ramp up towards World Hepatitis Day. But if you want to start using it now, feel free to use it at events you've got. If you want to start sharing it on social media, please do feel free. It's there for you, and please use it as much as you can.
Great. Another question from our audience is, how do you engage your WHO country office around the campaign? Do you have any tips for that?
Yeah, well, we, I think, and as many of you know, we work very closely with the WHO HQ, the Global HQ, and we also do work quite closely with the regional offices as well. So they will be, many of them are already aware of the Find the Missing Millions campaign, and we will be continuing to work with them over the coming months to really put it on their radar. So one of our big requests will be that this trickles down, and we'd really hope that every country office across the world is made aware of this. But you can also, reach out to them yourselves as a member of the World Hepatitis Alliance. Because we are in official relations with WHO, you are by proxy in official relations with the local representatives. So use that when you do reach out to them. Remind them that you have that relationship, and this could also really help them get involved in your activities.
Great. Okay, well, that's really useful for people to be aware of, and something that we need to continue highlighting within the advocacy community. So last question before we move on. You mentioned the social media graphics. Do you have any other information or tools on how our audience can use those?
Yes, of course. Well, the toolkit is a really good place to look. So we really encourage them to use them on social media throughout your posts. We also, for those of you that may have some budget, and it doesn't need to be a large budget, we have some real success in using social media advertising and digital advertising. As I say, even with sort of the equivalent of $10 or $20, you can make an impact and reach the people you want to reach. We have tips on how to do this to sort of make it as easy as possible for you in that toolkit. So the toolkit is available on the website right now, the campaign materials page on that website, and through that there should be lots of information. And this is also, I think, a good opportunity to remind you all that we do produce as many of our materials as possible in as many languages as possible in the 7 languages we work in. And I'm really glad to let you all know that the toolkit, which is really the sort of the cornerstone of the campaign, it has all the information you should need. That will be available in those 7 languages very shortly in the coming weeks.
Great, Bridie. And the last point before we move on, because there's a couple of few questions coming through. Our colleagues in Brazil have asked us, I've mentioned that there would be greater impact if our audience were able to translate the materials and use the materials and the logo within their own languages. Do you have any thoughts on that? So
sure.
Hepatitis Day logo and so on.
Yeah, certainly. Well, we certainly agree. For much of the information, it will be more, we will reach more people if it's available in more languages. Of course, we do as much as we can, but resources are also always limited. But we can, if there's a language that we're missing, get in contact with us and we can make the materials available, and you can help us translate those and reach as many people as possible. Just a note on the logos and things, so I think that's also an important point. The World Hepatitis Day globe, because that's quite a strong logo, just the globe, we have that available in lots of languages. I believe it's in about 40 or 50 languages on the website. The other logos, the Eliminate Hepatitis and the Find the Missing Millions logo, we, after some consultation with some of our representatives across the world, we felt that actually we needed to keep this in one language to ensure consistency throughout everything we're doing. One of the things that's really crucial to a successful campaign is also ensuring that everything is clearly part of the same message, part of the same campaign. So the logos themselves, the Eliminate Hepatitis logo, the Find the Missing Millions logo, where there was a decision made to keep this in English. However, we, through the posters, also ensure that this message itself is translated, so no one's missing the meaning. But as that's part of the brand, this will be kept in English to keep everything under the same banner and give us that one voice, that strong voice that will be talking together.
Great, thank you, Bridie. I have a few more questions, but I'll hold them until a little while later. And if anybody else in the audience would like to ask any other questions, feel free to share. Thank you.
Fantastic, and thank you, as Tara mentioned, thank you for the questions. We love to hear them. So my next point really is, and this is one of the things that will help us achieve the objectives of the campaign, which of course one of the key ones is to influence decision makers to implement those policies, the testing policies that we need to find the missing millions. And one of the things that we can all do is advocate. So we know, as Tara mentioned, World Hepatitis Day with now sort of half of the world's governments celebrating it, it's the one day of the year that we can guarantee that there's some interest in hepatitis. So use this as an opportunity to meet with them and really discuss the issues. We may not achieve our advocacy goals in just one day, but it's a great opportunity to kick that off. So see if you can contact them and arrange that meeting. And then when you're there, highlight the issues and really raise the awareness of the importance of testing people and finding the missing millions. It's also here that, again, that local data that we'll be making available in June could be really useful. We know that surveillance and data is actually really limited for many countries. So some of the decision makers you're speaking to may not even really be aware of just what the situation is in their country. So attend that meeting armed with that data and just highlight just how many people need to be diagnosed in your country. And if that doesn't work, and really even if it does, make sure you're contacting your local media. By getting the issues and your stories in the press or on the TV, on local radio, you can help reach more people, and then in turn sort of show the government that this is something that they need to pay attention to. And when you're reaching out to the media, again, that local data is going to be really, really important. But we also really encourage you to focus on the human stories behind the issues. And this will really bring your stories to life. And then lastly, collaboration is really key. We need to work together to ensure that we will find the missing millions. With as many as 300 million people that are undiagnosed, we do need to be on a united front to achieve this. So there might be a lot of organisations working in your country that have similar goals or work with similar at-risk groups. They could be perhaps harm reduction organisations or LGBT rights organisations. Contact them and see if you can work together, perhaps through activities or campaigns or media outreach, or when you're meeting with governments. Work with them. It will help to expand your network and really ensure that you have a stronger advocacy voice. As I've mentioned, and it's been throughout this presentation, it's all this information and much more. There's lots of tips on how you would approach the media, but also a sort of a timeline of all the things you need to think about when you're holding an event, and more information on social media, as I mentioned. That's all available in the World Hepatitis Day Toolkit. So do log on and look through that, as there'll be a whole, there's a wealth of knowledge there to support your activities.
Great. Bridie, we're just going to move over the slide. Oh, yes, great. Thank you, Bridie. That was a wonderful presentation. I hope our audience really took a lot from it, learned a bit more about the background of Find the Missing Millions and ways that we can get involved. And I think what Bridie and I really tried to achieve with the campaign was to create something broad enough to allow supporters adapt it in the way that they need to do. What we're very aware of, that it's not a one-size-fits-all approach. We recognize there's different issues, there's different challenges and barriers in different countries, and there's different situations. So in some countries there is a high diagnosis rate, but the problem is people still aren't coming forward in the case of hepatitis C to be treated. So it's a complex situation, but we think by focusing in on an area like Find the Missing Millions and a campaign that is broad allows us and you to really drive forward our national and international activities. So now we have about 5 minutes for questions, and I'm just going to access them here. Okay, so we've got a couple of questions saying we're already in the planning stages, and we hope that you'll see it soon. So that's great. We're very excited. We love hearing about what people are doing. We love seeing what you're doing as well. A question: can we print an ID card mentioning member of the Alliance? Yes, yes. So you know, the World Hepatitis Alliance, the benefits of World Hepatitis Alliance, it is a membership organization, and it really has that power of all the organizations. So we definitely would recommend or suggest and encourage you to use the Alliance logo on your own activities. It may help boost your own national advocacy activities, whilst also might help you link to other organizations. So another comment, our colleagues from Latin America said, thanks for all the tips. In Uruguay, it can be quite difficult to get people, to get different stakeholders involved, including government. And now they were going to try to work with WHO to do that. And I think, Bridie, you'd agree that WHO, working with the regional office and your country office, is a really important advocacy method, because they can really support your activities. They have data, they have tools and materials which can be tailored for your own national country, and can also start conversations with your government. Question for you, Bridie. There was a question from earlier. One of our members said that they are not planning to focus on diagnosis, but how can they still get involved with World Hepatitis Day?
Great question, and I'm sure that's probably going to be for some people where perhaps something like access to treatment is a more important issue. That's fine. It's really important that we are all using this day for, you know, important issues for us than not doing anything at all. Of course, the overarching theme of eliminate hepatitis is applicable to anything you're doing. So we would encourage you at the very least to be using that message, using that logo, and using the globe logo on your activities. Now, we also, because the materials are so adaptable and editable, you could also consider even using the campaign if you wish, and updating that message. So that might be another way to make the most of the materials without necessarily forcing yourself to focus on an issue that isn't a priority. We do, of course, I think, because we have identified this to be such an important issue, and we know it's an issue that no matter where you are, it's kind of a big problem for, you know, 90% of the countries or something. Do you consider how you could find the missing millions and use this diagnosis? It's important that together we do work to find those 300 million people.
Great, thank you. And I think also the linkage to care is a big point to play in this as well. Because the Find the Missing Millions, we recognise diagnosis is a massive part, but if people aren't linked to care, then the elimination of viral hepatitis won't be achievable. A couple other points that we can address quickly. Can we use the Alliance logos in our presentations and lectures? Yes, absolutely. We'd encourage you that. If you're a member of the Alliance, you're more than welcome to use that. Another question, is Find the Missing Millions our campaign for the next 3 years? So yes, so the World Hepatitis Alliance organizational strategy is focused on finding the missing millions, and that will run until 2020 with an overall objective of supporting WHO's global diagnosis target, which is 30% by 2020. But recognizing that we can't do that alone as the Alliance, recognize that we can't do it alone, we're arming ourselves with partnerships and through campaigns like this to do that. Another question. This is an interesting one, Bridie. In terms of the pictures and the posters, can you change the picture in the posters and not just the text?
Unfortunately, in this instance, we weren't able to make that editable. We worked very hard to try and ensure that we had a real range of models for the photos. We tried to make sure they were as representative as possible, and because the design is just so great, and we're really, really proud of the images that we have created. We think they're so impactful. It wasn't possible to create a tool that allowed you to edit that image. That said, you can still upload your logo, so that will always be on there. And we think that by updating that message, that's going to be a really important part of driving the facts home.
Great, thank you, Bridie. And just to end with one last comment from our colleagues in Canada, they mentioned we hope to exceed our event last year where they had over 500 people attend, and their event nurses tested 28 individuals. So I think that's a really nice point to end with, because sometimes when you think of global awareness days, it seems quite big and broad, but what we're hoping to achieve with this campaign is that all we need to do is test one person to get to the next person and the next person. So if we focus on doing things at a smaller scale, it'll have global impact. But I think that brings me on to my last point before I finish off with kind of some key dates. This campaign, as I mentioned, won't be achieved without all of the community working together. And what I want to keep in your mind over the next couple of months is we really want to hear your feedback on the successes and challenges of your national activities, especially in regards to your World Hepatitis Day campaign. We need to, as a community, we need to be strong in our position and show our impact and the role of civil society in achieving the elimination of viral hepatitis. So although I know how many surveys and evaluation documents that you receive, it's really important to understand what is working so that we can tailor and develop these campaigns to support more national activities. So over the next couple of months, you will be hearing from us regarding some campaign analysis. And we'd really be really happy if you could support us and feedback where necessary. And again, we're here to learn from you as well, as much as you are to learn from us. So it's definitely a two-way conversation. And if you have any questions about the campaign after the webinar, please contact Bridie or myself, and we'd be very happy. We're very happy to answer those. So a couple of key dates for your diary. There we go. In the next month, actually, there's going to be the first ever pilot Spring European Testing Week. It's an in Europe. It's an opportunity to highlight key testing initiatives and get involved. It's an important opportunity to start this process in terms of finding the missing millions. Then, of course, as Bridie mentioned throughout the webinar, the next big campaign milestone will be on the 14th of June, where we're launching our quest, and that means our webpage. And it'll be a chance for you to get involved, share what you're doing, any plans you have for World Hepatitis Day, and so on. And we're actually officially launching that quest at the Global Hepatitis Summit in Canada. So if any of you are going to be there, stop by the No Hep Village and find out more about the quest. And then, of course, it's World Hepatitis Day on the 28th of July. So I'm sure you all have that in your diary already. Great. So thank you, Bridie, for running us through that presentation. And thank you to everybody who've given up their time today to go through this webinar. It's really important, as I mentioned, and we hope that this will be the biggest and best World Hepatitis Day yet. As usual, after this webinar, we'll be sharing a recording of the webinar with the slides. And as mentioned, if you have any questions, feel free to get in touch with us. So thank you very much, everybody, and we look forward to talking and seeing you all soon. Thank you.
Thanks. Bye.